Okay, let's talk about what diabetes is. Diabetes is persistent elevations in your blood glucose level out of the normal range. This is a common problem, unfortunately, not only in the United States of America, but worldwide. It's estimated in the US that over 34 million people are living with diabetes, and 1 in 5 people don't even know that they have it. Prediabetes, 1 in 3 people have it, and 84% don't know they have it. So if you haven't tested your numbers, you should find out what your hemoglobin A1C is and check a fasting blood glucose level. There's a few different ways that we can diagnose diabetes. By the American Diabetes Association definitions, a fasting blood glucose level between 100 and 126 is considered to be in pre-diabetic range. Anything over 126 is considered to be type 2 diabetes. This is a fasting blood glucose level taken after at least 12 hours of fasting, meaning nothing to eat or drink, no calories for at least 12 hours. We can also use something called a hemoglobin A1C to diagnose diabetes. An A1C is glycosylated hemoglobin. Hemoglobin travels around on your red blood cells, and the longer that your blood glucose is elevated, those red blood cells are prone to something called glycosylation. A1C is a test that your doctor can check on you in the clinic, or you can do an at-home A1C test. The definitions for prediabetes and diabetes when we discuss A1C are a hemoglobin A1C less than 5.7 is considered normal. 5.7 to 6.5 is considered prediabetes, and anything over 6.5 is considered diabetes. Now there's a few different types of diabetes, so let's define what those are. The 3 that I want to talk about are type 1 diabetes, type 2 diabetes, and then gestational diabetes. Type 1 diabetes is thought to be an autoimmune condition where the body produces antibodies that destroy the beta cells in your pancreas. The beta cells are the cells that produce a hormone called insulin. The insulin hormone is what's secreted when you consume carbohydrates, and insulin's job is to take the glucose into the cells. With destruction of the beta cells and not making any more insulin, the blood sugars start to rise. Type 1 diabetes is typically diagnosed when somebody is young or in their teenage years, but occasionally can be diagnosed as an adult. Of all the types of diabetes in the world, type 1 diabetes accounts for approximately 5% of diabetics. The most common type is type 2 diabetes, and this is mostly related to lifestyle problems. Overconsumption of carbohydrates, lack of exercise, poor sleep, and stress all lead to persistent high blood glucose levels that cause you to secrete more insulin. Then the body stops being able to utilize the insulin to take the glucose into the cells, and you develop diabetes. Now, this is a process that can take 5-10 years to develop. So before you get diagnosed with diabetes, you'll go through years of pre-diabetes, and prior to that, years of insulin resistance. This accounts for about 95% of the diabetes that we see worldwide. Type 2 diabetes absolutely can be placed into remission with lifestyle modifications, control of carbohydrates in the diet. It's important that you test your numbers and know where they're at so that you can see your progress in correcting the blood sugar abnormalities. Then the 3rd type is gestational diabetes, and this is diabetes that we only see in pregnancy. Gestational diabetes screening is done at approximately 24 to 28 weeks during a pregnancy. Your doctor will typically administer something called a glucose tolerance test. The most commonly used glucose tolerance test is a 50-gram glucose challenge, where a pregnant patient will consume 50 grams of glucose, and we check the blood sugar 1 hour after the glucose challenge test. There's some difference in opinions about what the cutoff is, but essentially anything over 130 and especially over 140, 1 hour after a 50-gram glucose challenge is considered to be at risk for gestational diabetes. Most doctors will then perform a 100-gram 3-hour test to confirm the diagnosis. It's also possible that your doctor or midwife has performed a 2-hour glucose challenge, but essentially we're giving you a load of glucose to see how your body responds with the insulin and the ability to take the glucose back into the cells. Persistent elevation of glucose in pregnancy is extremely dangerous, not only for pregnant women, but for their unborn baby. People who develop gestational diabetes have a 50% increased lifetime risk of developing type 2 diabetes later in their lifetime. So if you are somebody that had blood sugar problems in their pregnancy or had a diagnosis of gestational diabetes, it's important after your pregnancy that you do follow-up testing to know what your fasting blood sugar is and to know what your hemoglobin A1C level is. Babies born to mothers that have gestational diabetes also have epigenetic changes that increase their lifetime risk of obesity and diabetes. So talk to your mother. If she had gestational diabetes during her pregnancy, you are at a higher risk than at baseline. So let's talk once again about how to control diabetes. We can control our blood sugar levels by controlling the amount of carbohydrates that we take in. When we consume carbohydrates, whether they're simple carbohydrates or complex carbohydrates, our body breaks down the carbs and puts glucose out into the bloodstream. Then it secretes the hormone called insulin. If we reduce the amount of carbohydrates that we eat, we force the body to produce less insulin, and therefore we correct the high blood glucose levels. You'll only know this by actually testing what your blood sugars are, because all of our bodies respond differently to different types of carbohydrates. The other macronutrients that you would be consuming would be protein and fat. It's an interesting fact, but actually carbohydrates are non-essential for human life. Our body has the ability to make glucose from other substrates like protein and fat through a process called gluconeogenesis. So one of the easiest, fastest ways to correct blood sugar problems is to reduce glucose loads in the diet. You want to increase your calories from fat. You never want to spare protein, because protein is super important for maintaining our lean body mass and other functions inside of our body.